Welcome back. Joining us to continue and evolve this conversation is GP David Lloyd from the Ridgeway Surgery, and Dr Lloyd has long spoken up in favour of the COVID injections offered by companies like Pfizer and Moderna. If I can come to you first, Andrew, you also spoke and asked a question in the House of Commons this week. If you could bring us up to date with that.
On Thursday, in Business of the House questions, yes. I've been passed some papers from the Hebrew University of Jerusalem by two learned doctors who've analysed the test data and reanalysed the Pfizer test data, and what they've uncovered, it shows clearly that there were two batches of vaccines produced, and so the vaccine that was actually rolled out around the world to billions of doses, including the boosters, it actually wasn't the same vaccine, and it wasn't manufactured in the same process as the vaccine that was tested on 44,000 volunteers and subsequently got approval across the world. This raises huge questions, and clearly that will explain why the harms we've seen, the adverse effects on our yellow card system, is so different from the data shown in the trials by Pfizer, because they're different vaccines produced in different ways.
And what response did you get in the Commons when you raised that issue?
Well, I think that the MHRA, our own regulator, must know about this. If my researchers can dig this out, surely they can. If they didn't inform the minister, that actually would be a criminal offence, and I pointed that out. And obviously, if the minister was aware that the vaccine that was rolled out hadn't actually been tested on 44,000 people, as was claimed, it's actually rather worse. But because of all of this, what it means is that there could have been no informed consent for the Pfizer vaccine or boosters, because people were misled that they were trialled on 44,000 people when they weren't.
No, obviously, Dr Lloyd, I'm sure you can predict the question I would ask. How do you react to hearing that, which is an evolution on the story that we've been being told over a long period of time?
Well, it's terribly difficult, isn't it, to react to the latest conspiracy theory against the...
Conspiracy theory?
Yes, I think so. Tried against the facts that we have about the COVID vaccines, which is that they have saved millions of lives. The latest data is we've saved 14 to 19 million lives worldwide by the introduction of the vaccine. And I'm speaking personally here because I have to speak personally. I was running a COVID hub looking after patients with COVID, and towards the end of the epidemic, when patients used to ring in with COVID and we'd be seeing them, the first question you ask is, were you vaccinated? And the people that died, the people that I sent into the hospital, were the unvaccinated patients.
I'll be frank with you. I'm honestly amazed that you're quoting the millions of lives saved rhetoric. From which source? Can I ask you from which source?
It's modelling. It's modelling. It's the lowest form of scientific research.
From what source does it come? A peg upon which to hang so much?
I was quoting from a paper in Nature. I mean, these are some reputable scientific journals with reputable scientists who've done the research, and the data is there. It's you can't dispute it.
But David,
conspiracy theories are not the answer to a scientific basis.
If the vaccines are safe and effective,
yes,
they've now been trialled on billions of doses. 6-7 billion doses have gone out.
Yes.
Why do Pfizer, Moderna still need immunity from prosecution? Surely they are safe and effective now. Why Pfizer never put a vaccine into India, the potentially biggest market for vaccine and therapeutics in the world, biggest population? Because the Indian government will not give them immunity from prosecution.
I can only counter that by quoting the science and the stuff that we see on the ground about what the vaccine has done to save lives. I'm afraid I'm not a lawyer, I'm not an MP. I can't use your research to find these very obscure pieces of information. But the big information, the stuff that's out there that we know that has shown it, shows that the vaccines are not only incredibly safe, that the benefits far outweigh the risks.
But would it concern you? Would it concern you if you found out that the Pfizer vaccine and the boosters had had not been tested on 44,000 people. That was a different vaccine, and that the vaccine that was rolled out around there was actually cultured in Escherichia coli with all the endotoxins involved. That wasn't in the test. That wasn't in the trial.
Of course I would be concerned. And if you
I'll send you the papers.
Well, if you go back to the original research, the New England Journal of Medicine, which was done by Pfizer, those bits of data there are fundamentally important.
Then why did Pfizer want to hide the data for 75 years?
But did they? I think this is the point. Did they? You can't just come out and say these things without having the basic facts.
I mean, there are so many items there to unpick. You know, the New England Journal of Medicine, like Lancet, editors of both have all but said in public that those publications, like all medical journals, are compromised by... I mean, they're effectively information laundry services for Big Pharma. And the editors of those publications... And there is no peer-reviewed information that's... Those are paid-for, placed, non-peer-reviewed items that go in. But
hold on. I have to just correct you there. The paper was peer-reviewed by all their peers. New England Journal of Medicine is not paid for by advertisers. It's paid for by its subscribers. It is the #1 medical journal in the world.
It takes a huge amount of advertising from Big Pharma.
But so does your television company. So do MPs. You can't distinguish people because they've had people putting money.
If I can ask another question. You know, you referred to that early research. Now, Joseph Freeman in Louisiana, him and his team reanalysed that early data that you're talking about, and from it came information that you, Andrew, amongst others...
Pfizer was 1 in 990 severe adverse events, and Moderna was 1 in 662.
For every 800 doses of either Pfizer or Moderna that were administered, there was an adverse effect. And the adverse effects for the Pfizer and Moderna vaccines is more than all of the adverse effects that were reported in relation to all vaccines in the last 70 years combined. So what I mean is I think that the story has moved on, and to keep quoting out-of-date data is not helpful.
I dispute that. I think that you're basing these things on small theories, just like QAnon has extraordinary theories about the prime ministers. You are niche people with niche ideas and niche data. We should be going on the stuff that we really do care about.
This is the work of eminent physicians.
No, it's not. It's crackpots that are saying these things. I've watched your block tube or whatever it is. You've got a whole pile of loony doctors out there spouting this stuff.
I really do think that is beneath you to suggest that your fellow physicians around the world who have spent months and years trying to...
And they're losing their reputations.
Like any profession, you're going to have loonies in your profession. You have loony news announcers, you have loony doctors, loony GPs, and you have loony scientists. But they are in the minority, and I'm afraid they are the ones that are causing this debate, which is totally artificial, and it's actually it's demoralising scientists, and it's reducing this whole thing about what is fact and what is fiction. We used to be we used to believe that you could sail off the edge of the earth. We used to believe that Brexit was a good thing. We used to believe that there was no climate
It would be if we actually delivered it.
A majority of people did think and do think that Brexit was a good thing.
Well, that is complete
if I can bring you in,
nonsense.
you're another reasonable person. You know, you're looking on at this, you're listening in on this debate. How do you react to what you're hearing here? These very divergent opinions.
Yeah, first of all, disclaimer, I'm vaccinated, I'm fully vaccinated because I believed at the time that was the right thing to do. And I don't regret it, but I do feel very, very sorry for people who are having adverse reactions. That's 100%. I agree with the doctor in that the wider picture seems to be that it has saved many, many lives around the world. But I agree also with the fact that if we were told that it was tested on X amount of people and that batch that we were given was not, then I think anybody, vaccinated or not, pro-vaccine or not, has a right to query that and ask why. That's where I stand on it.
Doctor, if I can ask you again, in relation to that millions of lives saved.
Yes.
Now, that was a paper by a team led by Azra Ghani out of Imperial College London. Now, the paper was sponsored by Gavi, which is the Bill and Melinda Gates Foundation by any other name, by the Bill and Melinda Gates Foundation and by the World Health Organization. And Dr. Azra Ghani, let's remember, was pro-fear, pro-vaccine and pro-lockdown throughout. So I would say questionable whether that would be an objective source of information.
There's a reasonable scientific basis to believe in.
And yet you continue to say, and that's not allowed, that's before we even consider the fact that it didn't take into account the waning toxicity of the virus. It didn't take into account the way in which different age groups are affected. It didn't take into account all manner of variables. And yet you're still saying millions of lives saved, and that's the only source for that claim.
Why, after I spoke out, if it's all safe and effective...
If I could just let the doctor respond.
Well, I love the fact that you're trying to undermine science in general, but I object. I object on every level to these...
But just objecting is not enough. We need science. Why did the government stop the rollout? Why did the government stop the rollout of the vaccines to the under fives when I spoke out in Parliament last December when it was rolled out across if there was no risk?
I'm afraid...
Why did when they were asked to authorise them, why didn't they in the end?
As I say, I'm going to come back to my basic premise. I'm a GP. I work on the ground. The people that I saw with COVID who died were unvaccinated, and the people who didn't die were the ones who were vaccinated. And that is the same if you talk to every reasonable doctor around the world. They have seen the effect of vaccines, and that there is no doubt about. And the fact that you're bringing up this stuff is undermining the whole scientific principle. What's going to happen in the next pandemic when there is these counts are there?
How did you react?
If another company brings along another vaccine, are you all going to say, sorry, we won't do that?
How you react to the fact that when the Pfizer spokesperson, in answering a question, made plain that Pfizer had never even been asked to test whether their product would stop transmission, and yet the entire get an injection to save your community was predicated upon a non-existent fact. It had never been tested for stopping transmissibility. How did you react to that?
Well, that was a later stage, wasn't it? The first thing to do was to protect individuals, and that we know it does. It not only protects you from dying, but it prevents you from getting serious disease and hospitalisation. Are you doubting that?
I absolutely question that. I
you
question the safety and efficacy of those products.
Fact that the Pfizer vaccine works?
Well, if you're asking me, I think those products did nothing or they caused harm. But that's purely my opinion.
But that's nonsense.
I'm going to go... It's not. It's a matter of scientific challenge.
Have you been vaccinated?
We have to go to a break.
Unfortunately, yes.
So Andrew Bridgen has been vaccinated.
I haven't. I am untouched by the needle, and my whole family.